over there, it's fine. We'll get started in just a few more minutes. See if we have any stragglers. Mason, Radmaker? Radmaker. Good, thank you. so far? Thank you. Cookies in the back. Jorge already has 4. But, So good evening, everyone, and welcome. My name is Jennifer Bramley. I'm the city manager of the city of Dunedin. Thank you all very, very much for coming to the second of 3 public input meetings in regards to the American Rescue Plan Act and the funding and the expenditures regarding the American Rescue Plan Act. And so we had a meeting this morning at City Hall, and that meeting was aimed towards our commercial community, our businesses, although the public are always welcome, the general public, and then this evening is a general invitation to the public, and then we have another meeting on November 17th from 2 to 4 at City Hall, and that is for not-for-profits, but of course the businesses and the general public are more than welcome to attend that meeting as well. So a special thank you to all of you who came out of your homes and ate your dinner early to be with us this evening. We are also Facebook Live as well, so I know that many of your fellow residents are at home watching, and I know in fact quite a few watched this morning as well, our meeting this morning. They'll be posting some comments in the comments section, and we'll do our best to get to those this evening. And so I ask you all to be sure to sign in with an email address if you're comfortable with that, so that if we have any follow-up after this meeting, we'll be able to communicate with you as well. Our agenda today takes about 2.5 hours to get through, and then we're actually we're going to be talking to you for about half an hour, and Les Tyler, our Director of Finance, and myself will be leading the presentation, and then we're going to open it up to all of you for your input. We're not going to be, during that public input section, we're not going to be necessarily answering your questions. We are seeking your input, and we may need to react to that later on. So this is what we categorize in our rules of procedure of the City Commission as a town hall meeting. And what that means is that it's a meeting convened by the City Commission, if you will, that they invite the public to give them input on a single subject, in this case, expenditure of the American Rescue Plan Act funding. And then they will give staff direction at a later date, and we'll talk about that a little bit later on. And so the City Commission during these town hall meetings, they're all here, and they will be listening to all of you, but they most likely will not be speaking. So I'd like to introduce my 5 bosses to you, if I may, before we carry on. Mayor Julie Ward-Bajowski at the back there. There she is. Vice Mayor Gao is right here. Commissioner Deborah Kynes in the back as well. Commissioner Mo Franey, and Commissioner John Torga in yellow this evening. And so we also have some staff members here to listen to what you're saying. And we have Jorge Quintas, who is our Deputy City Manager. We have, hello Jorge. And he has already laid into the cookies, so anyway. So, they are edible? Yes, they are quite edible. We have Les Tyler, as I mentioned, our Director of Finance, and he will be helping me this evening. We have Bob Ironsmith, our Director of Economic and Housing, and also our CRA Director. We have Vince Gizzi, our Director of Parks and Recreation. There it is. And then we have Sue Burness, who is our Director of Communications. And so Sue is in charge of communicating with you thereafter, all of the things that we're going to be doing with the American Rescue Plan Act. And so let's carry on. Oh, I forgot. Also, we have invited our consultant, Whit O'Brien, and this evening we have Mason Rademacher. And our consultant is helping us administer the American Rescue Plan Act funding. It's actually very intricate, if you will, expenditures, and we want to make sure that everything that we spend money on is eligible. And so we put it on them to make sure to tell us that it's eligible. We don't want to be in a situation where the federal government claws back anything that we're spending. All right, so I think you've all been reading about it, and I think you're very interested in it, or you wouldn't be here this evening. So in March of 2021, the American Rescue Plan Act of 2021 was signed by President Biden and enacted by Congress to combat COVID-19 and the pandemic economic impacts, including support for business recovery, job losses, and public health. The stimulus package includes $350 million to state and local governments that qualify. Pinellas County received $189.3 million, and the city of Dunedin qualifies for funding up of $18.3 million. We refer to this as ARPA or ARPA, and we're probably going to use that throughout the presentation. And so, the grant funding is released to us in two increments, two payments. We received the first on October 8th, and that was for $9.1 million. We anticipate the second in October of 2022. The funds must be obligated by December 31st of 2024. And that seems like a ways away sometimes, but it's really not, because we're going to be competing with the county and other cities as far as supplies go, labor, personnel, and those types of things for capital projects. So that really is right around the corner, and we do have a sense of urgency in the city of Dunedin in regards to the American Rescue Plan Act funding. The funds must be, the deadline for the projects to be completely obligated and paid for is December 31st of 2026. Now, some of the larger cities, for example, St. Petersburg and Clearwater, those are entitlement cities. And an entitlement city is any city over 50,000 that receives funding directly for programs like community development block grant programs directly from the federal government. We do not. We're 37,000+ folks, and we receive ours through the county and through the state. And so we received ours just in October, so technically we're 4 or 5 months already behind some of the larger cities. But don't worry, we're going to catch up, that's for sure. We're going to be issuing periodic reports, which Wood O'Brien is going to be helping us with on expenditures. And so the City Commission, and Les is really going to get into a lot more detail on this, when the City Commission approved the contract with Wood O'Brien, and thereafter, during the course of a workshop, we spoke to the City Commission about what some of the projects that could and would be eligible for the American Rescue Plan Act funds. But I want to be very clear. There are two projects, which we'll talk to you about in a moment, that the City Commission has approved for American Rescue Plan Act funding. That's special event seed money to get special events up and running again, and that is also an affordable housing project. To go in that we're pursuing on Union. And so all the other projects are at this point simply ideas. We are waiting for the public input session to put the entire program back together and put it before the City Commission for them to adopt all of those projects and capital projects. And we'll probably be able to do that late January or, as our finance director tells me, early February of 2022. The projects, the federal government arranged the American Rescue Plan Act funding into buckets. And I just want to go over those 6 buckets for you, and then Les Tyler is going to get into a little more detail. So the first one is support for public health expenditures. The second one is address negative economic impacts caused by the public health emergency. And we talked about that one with the businesses quite a bit this morning. The third one is serving the hardest hit communities and families. The fourth one is replace lost public sector revenue. The fifth one is provide premium pay for essential workers. And then the sixth one is invest in water, sewer, and broadband infrastructure. You're not going to see a lot of the capital infrastructure projects like water, wastewater, stormwater, those types of projects included this evening. We're looking very closely at the infrastructure that was just recently approved, the infrastructure plan that was recently approved in Washington, D.C. And also a lot of those projects are already baked into our budget, into our capital programs for our budget. And so if they're eligible for either ARPA or infrastructure, then we'll be able to use those funds for them and free up some additional revenue in those areas. So that's still ongoing, and I just want to impress that upon you. So with that, I'm going to turn it over to Les Tyler, and then we're going to have our public input session. When we get into public input, I want to be very clear that just, nothing's off the board. We want to hear from you. We want to hear how you feel as residents or business owners of the city of Dunedin that the American Rescue Plan Act funding can help and benefit the city, its residents, its businesses, its visitors, and all those folks. So I'm going to turn it over to Les now, and then you're going to have to put up with me a little more later.
Thank you, Jennifer. And I am Les Tyler, Finance Director for the city. And again, we have Mason Radmaker here with Widow Bryan with us today also. Before I go into the next slide, I'd like to briefly just mention a few things about this ARPA grant and sort of what makes it unique from my perspective, I've done grants for lots of years, and this is a little different animal compared to most. This grant is unique in the fact that most grants through the federal government are, first of all, they're done through a competitive process where cities or counties apply for grants, and the scope and the way what you can spend the money on is very clear in those type grant applications. The applications are submitted, and if you're successful, you win an award. And then normally, if you are awarded, it's normally on a reimbursement basis. We spend the dollars, and then they turn around and reimburse us 1 month to 3 months later. This grant is unique in that this grant is given to us up front. As Jennifer mentioned, we received $9.1 million a month ago, and we expect the remainder in about another year. And that's different because, and the other thing is that this grant is putting the onus on our city to make sure that we spend the money properly. In a normal grant application, you know what the parameters are before you even are awarded the grant. In this situation, as Jennifer mentioned, that's one of the reasons we have Widow Bryan on board, because we want to make sure that whatever we do is eligible and allowable under the grant, and we have no concern about clawback or the federal government coming back. It could be years later, and with audits and things like that, and having disallowed costs and having to reprogram money and all that stuff. So we're being very careful that we do it right, basically. So I want to point that out. And also, the U.S. Treasury has some guidelines they recommend that cities and counties follow. I want to briefly mention those when you're developing your plan for the ARPA. And they mention be careful creating new programs or add-ons that require ongoing financial commitments or legacy costs. I want to be careful not to add a lot of new projects that are going to be ongoing expenditures forever to the city. Also, they recommend replenishing revenue losses due to COVID and rebuild financial flexibility for the city and restore fiscal resiliency at the state and government level. And the next item is they want us to collaborate with other governments. They're encouraging that we work with other governments, and we are working closely and following what the county is doing, the county of Pinellas, and we'll be continuing to work with them to see what sort of initiatives that we could work on that are similar, and we could work on together with them and possibly other jurisdictions as well. And also the last one is to carefully plan and use the dedicated funds programs first, and try to save these ARPA dollars we're talking about today, if possible, for other priorities not eligible under other programs. And a good example of that is what Jennifer mentioned. The bipartisan infrastructure bill, as you know, is just finally moving forward, and it's providing funding for bridges, roads, transit, broadband, and other projects. So we'll be looking very closely with Widow Bryan and trying to look at those buckets and see what all of our projects are eligible in those competitive grants, and see if we can get as many dollars as we can there and be able to leverage our ARPA dollars that we're talking about today. I also want to mention that on October 5th, as Jennifer mentioned, the staff presented a workshop to the commission to kind of go over where we're at with the American Rescue Plan. And much of the information we're going over today is what we shared with the commission back on the 5th. And I'd like to now move to the next slide, and that is I'd like to walk through and kind of go through these 6 categories and talk about what we've done so far and things we think we can do with this ARPA funding. And starting with this is the support for public expenditures. And the key terminology for this is responding to COVID-19 and broader health impacts of COVID-19 when using funds under this category. And recipients must identify a need or negative impact from the COVID-19 public health emergency and identify how the program, service, or other intervention addresses the identified need or impact. So some things we've done in this category is we've had COVID-19 vaccine pop-up sites. We've had one in March 2021 and another on April 15th. We also had a booster event on October 25th in the city, and there's another one that is scheduled for the last week in November, and the flyers for that event should be going out this week. Some other examples under this category would be contact tracing and personnel protective equipment and mental health services. Now, things we can do under this category would be, one of the projects we've identified is the Fire Department Mobile Command Vehicle replacement. That's an older vehicle, and we could get that with updated technology, and ensuring safety of personnel is a potential allowable use under this category. And the second category is the address the negative impacts caused by the public health emergency. And this one is in direct response to the economic impacts of COVID-19. The ARPA funds can be used by local governments to provide expansive assistance to individuals, households, small businesses, and impacted industries. Assistance to households that face food, housing, or other financial insecurities. And another key area in this category is supporting our local travel, tourism, and hospitality industries. So things we've done in this category are the city's offered signing bonuses at a job fair, which is allowable under ARPA. We're supporting local travel, tourism, and hospitality with the Marketing Task Force and the Alliance at the city. We have special events assistance funding, and Jennifer just mentioned that earlier. That is one of the, on October 7th, the Commission approved supporting all of the special events the city owned, and also the other ones for the outside nonprofits and businesses. And that was approved to cover 1 year of the cost for all those events. So that was approved by the Commission. And also we did temporary outdoor dining. And for things we can do in this category, there's quite a list in this section. This section is tourism and fairly broad, and I'd like to go briefly over the 6 initiatives that we've identified thus far that we think would be good eligible projects. First is to provide additional commercial facade grants to small businesses citywide. The next is having discussions with Dunedin Chamber of Commerce for business support services or a hub on the 2nd floor of the chamber. And the third is Clearwater Ferry service contributions for expanded service from Dunedin to Clearwater. And the fourth is downtown looper service to explore this as a people mover in downtown to address parking and traffic issues downtown. And then the next is the Highlander Pool replacement project. And the last of the 6 is golf course capital improvements. The next is category 3, which is serving the hardest hit communities and families. And funds from this category are to address disproportionate public health and economic impacts of COVID-19 pandemic on the hardest hit communities, populations, and households. Under this section, local governments may provide services within a qualified census tract to families and households or geographical areas disproportionately impacted by the pandemic. And best example of this is for affordable housing and housing assistance. Lots of opportunity in that area. And things we've done in this category, the pop-up vaccines do fall under this category. We mentioned that earlier. And things we can do in this category is we have an affordable workforce housing project that Jennifer mentioned. That's another project that's been approved by the Commission. If we're successful with the application on that, we would use those dollars for some of the seed money on that project. And then also provide aid to Dunedin Cares is another one. And the next section is replacing lost revenue in the public sector. The pandemic hit the public sector fairly hard. Cities had to slash spending throughout the country. Our city was no exception. Our general fund was impacted. And our general fund is our main discretionary fund. It's where the majority of our departments are paid from, our fire, police, our Parks and Rec department, for example. And it's sort of our main operating fund, where we have a lot of activity and departments that are paid through that fund. It was impacted, obviously from April 2020 through September of 21, that 18-month period. We had reductions in sales tax, revenue sharing, and some other state revenues, as well as large reductions in program revenues. The Parks and Rec department closed down. All the program revenue for that, obviously goes down. And also, we ramped back up, but not to full capacity. So we had some impacts. And the best estimate is about $2 million for that 18-month period of revenue was lost in the general fund. And the Treasury guidance on this is basically that a local government can calculate our lost revenue by a formula that they've created. And you basically look at 2019, which was the last year before the pandemic, and you do a mathematical calculation, and it determines what your revenue recovery might be. And we've done those estimates, and we've included revenue recovery dollars in our 22 budget for the general fund, the gas tax fund, penny fund, and marina fund at this point. And number 5 is providing premium pay to essential workers. This is recognizing the continuous work of essential workers through the pandemic. The funds can be used for premium pay directly or through grants to private employers for essential workers who were or are physically present at their job sites, including those whose work involves protecting the health and well-being of the community. The city is currently in the process of developing a program for this for our essential workers. During the pandemic, to provide premium pay, this would include people in the water department, sewer department, and sanitation, solid waste department, and others who are deemed essential in the city. The fire department did receive hazard pay when the pandemic first started back in June 2020. The fire department received hazard pay, but these other essential employees and other departments have not received any hazard pay or premium pay to date, so we're looking at addressing that. And the last category is category 6, and that is really the infrastructure side, and that's for water, sewer, and broadband infrastructure. They're pretty definitive on those type projects only in this category. For the water sewer, funds can be used in a variety of ways regarding water sewer infrastructure. The water and wastewater projects are eligible if they align properly with the Clean Water State Revolving Fund and the Drinking Water State Revolving Fund definitions, and those are pretty broad, so there are quite a few opportunities in that area. And on the broadband side of it, the broadband investments are also available for wireline infrastructure that needs to provide 100 megabytes per second symmetrical standard speed and may be made only in areas that include underserved or unserved. And they also recommend that recipients should pursue fiber optic cabling as much as possible when doing these type projects. So some things we can do in this category are we have a septic to sewer connection program project that we think is it's an eligible project we think is worthy of consideration. And also we have a broadband fiber optic Wi-Fi project that would basically provide Wi-Fi to all the parks in the city and many of the city facilities that don't currently have Wi-Fi. And I want to mention that there are some areas that are not eligible that is clearly stated by the Treasury's guidelines, and they include, there's no offset in revenue reductions, that is not eligible. We cannot deposit or pay into pension funds with this funding source. Cannot pay debt service, there's no payments on current debt service, and cannot use it towards legal settlements or judgments. And the last one is no deposits into rainy day funds. They don't want cities or counties building up their reserves with this funding. They want the money, spent on projects, that make sense. And for community engagement, we have, in addition to our input session this evening, we had, as Jennifer mentioned, our business session this morning at 9 o'clock at the City Hall Chambers, and we will have a session for not-for-profits input on November 17th at 2 p.m. at the Dunedin Library, same place here. And also want to mention there's a survey will soon be available through a third-party survey company. The survey will be available on our website and accessible through our social media platforms. And for next steps, really the next step is really community feedback from this evening and feedback from our other two sessions, the one we had this morning and also next week. And then the plan is, as Jennifer mentioned, the first quarter of 22, probably late January, early February, we'll bring back to the commission all the information that we received from our input sessions, our 3 input sessions, and survey information, and all those results will go to the City Commission for their input and direction. And that completes our general presentation, and I'll turn it back over to Jennifer to go over the discussions and questions.
Thank you, Les. So do we have a microphone?
We do.
Okay, thank you. Antonella is going to come. She has a microphone, so those at home can hear what we're saying. As I said, this is the public input portion of the meeting. And just to give you an example to start things off a little bit of some of the comments during the morning meeting, the businesses wanted to see assistance to small businesses. A lot of them had really suffered through the pandemic. They'd like to see the offsets for the small business. They'd like to see improvements down Main Street. One really bright idea was to essentially cool Main Street to create canopy and shade and put in the type of pavement that kind of reflects the heat and those types of things. And that's actually environmentally sustainable as well. So that was a good idea. So it's those types of things. There's really no bad idea. But the overwhelming theme is how do you feel that we should use this funding in order to help all of you and all the residents within the city of Dunedin. So we have, Antonella has the microphone. If anybody would like to put up their hand, you don't have to be shy. There's, like I said, there's absolutely no wrong answer. I even have heard, we think you should send it back, you know, and there are folks who feel that too. So, yeah. Georgianne, can you believe that? No. Yes, right. And so, does anybody have any comments on anything here? Any way that we can help your neighbors? Yes, sir.
So, going back to...
Could you hold on 1 second, because we got a microphone for you. There you go. Thank you. I know you do, but...
I can talk really loud.
I know, but there are people listening too.
All right. Oh,
We won't make
okay.
you sing.
All right, thank you. No, you'll thank me. So going back to number 4,
Yes.
where it was lost revenue by the city. So I guess my question is, A, I didn't hear how much you could keep of that money, and B, I guess the question is, in what state is the fiscal health of Dunedin, I guess? I don't know the budget, I don't know we're surplus, so where are we in that term?
And I'm going to have Les come up and answer that.
Yeah, right now, as I mentioned, we lost about $2 million roughly, for that 18-month period. So that, we have a reserve policy for the city for all funds, our general fund reserve policy, and that's sort of our reserve goal, or rainy day fund, you could call it, I guess, is 15% of operating expenditures. So that's kind of what we want to try to keep that much of a reserve year over year. So we were challenged with that with COVID. We were challenged with that, and but quite frankly, the ARPA is going to replenish that $2 million, for sure. And so right now with our current projections, we're in 22, we're well over 15%. Our estimates for 23 are right at 15%. But that is including this revenue recovery, calculation in there. And we don't know exactly what the revenue recovery is an actual calculation every year. And at the end of the year, you do a look back and you compare what happened in 20 to 19, and then what happened in 21 to 19, because 19 is that base year. But our estimates are, we think that that general fund recovery will be about 2.3 or 4 million. That's what we have estimated in the budget. We think that's a reasonable number, and we really don't know. We really won't know until that year's trued up, but that's kind of what our estimate is. And then we also have some estimates in the gas tax funds. They were impacted quite a bit, and our penny fund was that impacted some. And also the Marina fund. But overall, right now our fiscal condition is good. I mean, we did get impacted with this, but with this revenue recovery that we're anticipating, it brought that back. So we're in pretty good shape.
So just if we're allocating that 2 to 2.3 million, does that mean we're really only having 16 million or a little less than 16 million to allocate for other things? Is that correct then?
Yes. Right now we've got $2 million, $2.2 million budgeted again. It's not an actual number, and it will be some number. And then we have budgeted. The only other items we have that are identified would be that in a budget, and then also the housing project in a budget that we mentioned.
Do we have a dollar amount for that?
The housing project, if successful, is $650,000. Yeah, that's the city's contribution towards a 70-unit apartment complex. And then the other was the special events were, I think, $403,000 for all the special events contributions. And those are the only ones that have been identified with funding.
So we're down to about 15 discretionary then. Would that be fair to say? That hasn't been allocated.
I mean, well,
The estimates are conservative, though.
the estimates are conservative, they are, and, I'd say more like maybe 15 to 16, I think 15 is on the low side, but I'd say 15 to 16 probably, yeah.
And when we say the estimates are conservative, I want to add that when we start the budgeting cycle, we estimate how much we're going to acquire in gas tax, in penny for Pinellas, and those types of things, and we always budget very conservatively because we're basing the budget upon that. Saying we're going to get less is better than saying we're going to get more and then being disappointed. And so I think that discretionary will move a lot when we figure out the impact of the pandemic and how much revenue we have coming in over the next year, because the penny for Pinellas, which is our 1 cent sales tax, did a lot better during the pandemic than we thought it would. I mean, we were really, really pleased about that. And just one final comment about that, because those are really good questions that you're asking. When the pandemic started, we put the brakes on all discretionary spending, and we actually stopped where we were. We had no additional hiring of non-essential personnel. And then we kind of repositioned our budget, if you will, to a deep recession. And we are pleased that we came out of that, not in a deep recessionary, but, a recessionary cycle. That said, we sent our employees home, a lot of them, just like everybody did. We did not furlough anybody. There were no layoffs, but there's also no increase in salary for our employees. And that was important because we knew that once we came back, they would need to come back. We needed to staff the library. We needed to staff, all the non-essential, and the majority did come back, and we do have an increase for them budgeted for this year in order to catch them up. So, in the back. Antonella has a cape on today, so she can.
Hi, thank you. So I saw in 2 buckets the possibility there was some mention of mental health
Yes.
issues. So, experts believe that there might be some latent mental health and substance abuse stuff out there because of the pandemic. So just a thought, in some communities down south, they've instituted like a family care navigator. It's an FTE, it could be a temporary position to help guide families and people to your nonprofits that offer all those services, maybe avoid wait lists and help cut through some of the red tape. So just a thought.
Marvelous. I love that idea. In fact, Commissioner Kynes had brought that up on the dais the other day, that mental health, and the commission had a good discussion about that coming through the pandemic. So really good comment. Thank you. Great comments, everybody.
I just wondered, Les, have you all decided with the 6 categories, are you dividing it evenly, or are some categories getting more of the funds?
I can take that. Actually, once we put the program together, I don't think that we'll be able to divide it evenly. But it's going to be very much like the penny for Pinellas, where we hear from the public, and then we have the projects. We put them all before the City Commission. The City Commission adopts those projects as a program, and then staff implements that program. This obviously is as bigger than our penny for Pinellas, so. And as far as the implementation goes, we're going to need additional administration. We may need additional staff to help us do this on a temporary basis to get through these next 3-4 years in implementing this program.
I have one more question. I see how important the water is, and of course Dunedin being known as a beach town or a water town, I would really welcome to see if there were any improvements made at the marina, because if you're sitting at Bon Appetit at the bar, you see so many. They're not just tourists, they're residents that love our water. So I would be for that, but also I was wondering about the septic systems, because I know there's so much runoff that goes into our water, not just from septic, but from lawn care, particularly Curlew Creek. And I'm sure the city has a really good handle on how many there are.
I think there are 256 that we said this, yes, Jorge, 256 septic tanks. And so, yeah, I mean, the City Commission has been very supportive of the septic to sewer program, and working with county. There are some unincorporated areas that are within our service area that we're looking at providing sewer to them and then annexing them into the city. So it's really a very broad program, but it's definitely, it really harkens to environmental sustainability, for sure, yeah. God bless you.
So I'll just say, I mean, we're brand new to Dunedin. We just moved here from Arizona. We're a neighbor of hers.
Welcome. We're glad you're here. So you met Georgianne, right?
Have you noticed we're calming her down?
Yeah.
It's really not
Good.
as
You
hyper.
can,
Not as hyper.
you can come anywhere with her then, right?
But the two things we've noticed when we tell people we're from Dunedin, they always talk about how great the downtown is and Honeymoon. So to me, as someone who was in business, those are the two areas that you want to put money to promote, to make better, whether that be streets, whatever that be a tarp, whether that be whatever it is. But, you know, even though I can't say it would personally benefit me, it just seems those are the two areas where you want to put money because they're going to generate extra revenue through taxes.
Yes.
So that's my personal input. Those two things, yeah, and other small businesses which provide taxes. So I'm all for downtown and Honeymoon.
Thank you. Thank you.
Sorry, I hope other
Wait a minute,
people
you're not
speak.
doing your job there, calming her
No,
down.
no, but I was thinking, when you talk about the loop, what is the loop? Is that the Jolly Trolley?
The looper.
The loop.
It's
Oh,
actually, we're
yeah.
looking as part of the business plan this year, and it's a program that you know, the mayor had put in front of the commission previously, and it really is a looper that goes in and around downtown, you know, probably from parking area to parking area, picking up people and dropping them off so that, so we can try to encourage mass transit. And the city commission supported putting that in the business plan for this year. Yeah, you know, kind of like the tiki rides, only, you know, it would be a little more regimented. Wrong word, but, you know, long day. Right. Yeah, we're not sure if we'll allow pina coladas on the trolley, but that's almost impossible in Dunedin, right, not to, but. Yes,
I'm
sir.
a relatively new resident too.
Welcome.
And I'm sure I could ask a number of things in the various buckets, but before getting into the weeds, a couple things a little more high level try to start. Is there a vision or a strategic plan for Dunedin and how these projects map into that? So that's one part, and the other part is this is one-off money, right? So to me, I would kind of echo what the gentleman before just said, is that whether it's those specific areas, but things that address systems, processes, catalytic investments that can generate, you know, longer-term revenues and stuff like that. I think, I mean, I would vote for those sorts of investments, since you have a, you know, pot of gold here that's going to not come back again, hopefully.
Right.
So, so those would be just a couple of things to start the conversation.
Absolutely, absolutely. In terms of strategic planning, we do every year. The City Commission meets in January to start our strategic planning process. We recently, 4 years ago, adopted a business plan. And the business plan is framed, as, if you will, around 6 EPIC goals. And you can find those 6 EPIC goals on our website. Under the EPIC goals are all of the initiatives, all of the capital programs, all the capital projects, and the programs that the city is currently working on. And all of those projects have a funding source associated with it, have a department that's responsible for it, and a time frame in which we're going to complete that project. And so everybody is pulling in the same direction in terms of what activities and actions we're going to be undertaking during 1 year, 2 years, and in a lot of cases, 3 years out. And so all of that is available on our website, and you're more than welcome to avail yourself.
Are these, that one asking, are the projects that are being proposed or will be proposed for these funds
Yeah.
also aligned or tested against, you know, priorities for the strategic plan?
Absolutely, absolutely. And so what we'll do, when the City Commission adopts this plan and this program, then we will align it with our business plan as well, as far as, and we'll probably have to cross-index, if you will, what is American Rescue Plan Act in the business plan, and to make sure, you know, who is responsible for it and when we're going to get that particular item done. So yes, it will align. It doesn't right now, because we're still in the fact-finding mode and the public input, status of state of the program. But it will definitely dovetail in with our business plan. Anybody else? How about Dwayne, Georgianne? Yeah.
No, go for it. I just wanted to ask, the 6 buckets, those came from the federal government,
Yes,
not from the city, correct?
correct.
So I appreciate how, that is going to be quite a project to align the EPIC goals with these.
Right. Well, originally we had 4 buckets, but then the federal government came out with 6 buckets. So we're not going to change their 6 buckets into our 4 buckets. So we're going to keep their original 6 buckets. And actually, I don't think that it's going to be as difficult as we think it is, just because the 6 EPIC goals, I mean, they're really all-encompassing. They're about, supporting our coastal community. They're about resiliency. They're about, creating a sense of place, which is just about everything we do in the downtown does. They're about art. I don't know if you've heard of that. Right, yeah, those types of things. So those of you who haven't, please do go to our website and look at the EPIC goals. And like I said, every year the City Commission touches upon all 6 of those to say, yes, this is still important, it's still germane, it's still what we believe in, it's still something that all of us support moving forward. So.
Dwayne Wright, if you don't know me by now. The one advantage of COVID and having a chronic cough, it's been wonderful this last 2 years, letting everyone know that I am not dying or spreading COVID. Okay. And like Tina this morning and the chamber director, I get flustered when I'm on the camera. Other than that, you all know I have an opinion. I listened to this morning's meeting, and I had a different presentation planned for tonight. But after watching this morning's meeting and seeing the government's buckets and their strings, they don't quite align with what I call my agenda, does not fall under these criteria, at least on the surface. You may know better later. However, I will touch base on where the freed funds that you're talking about, you just mentioned $3 million will be freed up, which is good because I've already spent it for you.
Oh, good. Thank you.
The general, the penny in that. Accessibility for all is my thoughts.
Mantra.
I'm an architect, and it's my thing. Accessibility for all versus its negative term known as the ADA. I have been documenting non-compliances on both the Title II city and Title III businesses for years. Unfortunately, I keep discovering new ones being created, and I think I'm going to see a couple more occur when I believe what's happening. I am ready to start turning over these findings to advocacy groups, lawyers, and the Department of Justice. These documentations, chapter and verse, probably exceed $1 million, if not more. I offer you an opportunity for a good faith gesture, although in most cases it will be too late. I have gone through your 6 points up here. I have a couple of suggestions on those. I won't go into them right now, but I strongly suggest you start looking at accessibility in this town. You would be horrified, as I am disappointed. And I've come to that conclusion that I've got to get this off my back and let other people take care of it, whether it be lawyers or the Department of Justice, or if the city wishes to work with me. As most of you know, I don't have to live here. And no offense to the city, I can't wait until I don't. But I would like to leave the city with a term I call accessibility for all. The statistics in this city, demographics, my numbers are off. 5% of the population is under 4 years old. They walk the sidewalks. 50% of the population is over 65, and the rest of us are climbing right in behind them. This city needs to be accessible. I am what you call today temporarily able-bodied. It means I can walk around. I can go around and find all this stuff. I could have a stroke tomorrow or hit by a car, and a lot of these places I would not be able to get to, and I would like to. So that is just my forefront. I know you've got a lot of work, Jennifer, in the city. I've been watching you for years, taking notes, trust me. And I understand how complex this is. Last summer, when I was unemployed, I got to watch all those budget meetings. It's a grueling process. I've determined I never want to be in city government. I'll just be a provocateur like the gentleman this morning. But I hope that you can utilize every dollar that's available and that you free up some of those funds and start addressing this situation. Web lawsuits are right up there right now, and the sidewalk lawsuits would make you cringe as to what's being paid out. There are some cities that $21 million. I think we only have 8 square miles of sidewalk, I don't know. But like I said, I have a couple of suggestions. You all know where to find me if you want to. Thank you.
Thank you, Dwayne. So accessibility for all would be an expenditure under ARPA.
It's called bad marketing. If they were to come up with the ADA, I think they would have come up with a better term. And I, as an architect, trust me, I know I have created my own non-compliances basically due to my lack of knowledge. But I went to Dallas a couple years ago and I finally got it. I just got back from Phoenix to the National ADA Symposium in Phoenix, and I can understand why you moved to Dunedin. No offense, but I did not. Well, the JW Marriott in the Rafter River was fine, but these are issues that will need to be addressed on top of fixing the water. I haven't noticed any difference, but what the hell.
We're working on that.
Okay, and I don't drink beer, but I do have a concern about the place that makes vodka. I haven't been up there to see how that's affected their vodka, but
Okay.
those are my comments. And like I said, if you wish to talk to me, you can. But I am progressing forward.
Okay, thank you, Dwayne. Anybody else? Okay, over here. Oh,
Good evening. I'm Chris Reese. I've been a resident of Dunedin for 8 years now, and I feel very much like a newbie. So I'm here kind of to advocate a little bit, but more to ask a couple of very specific questions, and I don't even know if this is the right venue. I live here only 6 months of the year. And that means that I depend a lot on the internet for my information about Dunedin, and that's where some of my questions come from. Do we have the capability to do reverse 911 communication with our community?
reverse 911?
So that in an emergency, not unlike the recent one with our sewer system, we can notify the public of, say, an evacuation or another kind of emergency. Do we have that capability?
Sue, can you answer that?
Through Alert Pinellas?
Yes, Alert Pinellas.
Yes, through Alert Pinellas. If you sign up for Alert Pinellas, you'll be able to get all kinds of alert systems that cover the city of Dunedin as well, especially during an emergency.
Can they notify about like the fire?
No, not through that. No, we don't have a system like that. We're looking at systems right now. There actually is a system through Alert Pinellas that we can sign up and actually get information out, but it's opt-in. So we're actually working with our HR director. She's looking at it for internal communications for our staff. And then there is also a module that would be part of that Alert Pinellas system that would be Dunedin specific. Yes.
So, Sue, could you please get with the resident after the meeting to talk about Alert Pinellas, how she could opt in? And so the comment is you'd like reverse 911.
I'm not really as interested for myself as I am for many of our residents who either don't know how or don't have the capability to use the internet. I know other places that have used it very effectively. So I guess I would advocate for anything that could provide clear and timely communication to all members of our community. That would be one of the things I would favor.
Okay.
And the second thing that I wanted to speak to, I've seen over and over on discussion boards with different kinds of comments, and that's the issue of affordable housing for our essential workers.
Yes.
And it seems to me we need to go at that in at least 2 ways. One being to provide more of it, and the second to provide better pay for our essential workers. So I'm really pleased to see both of those things in the plan. And if we can do more of that, I would support it. The third thing and the last thing that I would like to speak to are the young families of Dunedin. It was one of the things that attracted us to Dunedin, besides its natural beauty. When we first came to visit, we saw young families and young people all over town using the parks, out at Honeymoon, on the street. I was a former teacher. I would talk to teenagers and ask them, what's your school like? They were affable. They were wonderful. And I think in the pandemic, it became glaringly clear that inequity was a huge issue in the way that people did or did not survive the pandemic, sometimes literally. So I'm thinking about things like hotspots that can be moved into neighborhoods so that families without internet can have it in an emergency. I'm thinking of things like pop-up clinics to make sure that the kids who are now eligible for the vaccine can get it if they and their families wish to. And just in general, paying attention to young families and trying to provide a climate so that the people who work in Dunedin can live here. That's really important to me. Thank you.
Thank you. One of the things about the affordable housing and the reverse 911, and now I know the program you're talking about. I lived in a community that had the reverse 911. And so, you know, out of the county's 189.3 million, the cities, as Les Tyler had mentioned, we need to work with the county in terms of, you know, because the county runs dispatch. You know, and so we need to work with county to ensure and convey to them that this is something our residents are very interested in. And also affordable housing is a regional problem. And it's something that we as a region need to address and work together on. And you know, I know St. Pete has had a huge affordable housing project, and it's something that we would work with the county and the housing authorities as well. So thank you for your comments. Love the hotspot. Love the pop-up clinic. Thank you.
This is piggybacking off her affordable housing and the project, the 680, the one on Union Street, which kind of fell into Dunedin's lap. I'm not sure if...
Well, not really. Bob worked pretty hard on that one.
Okay,
But
Bob, you worked really hard to bring that in. Now I'm remembering some of the shenanigans and the people you undersold. Yes, I'm not sure I like that either, because I was working for private industry.
I don't know what you're talking about doing, but anyway, go on.
Well, go back and listen to the tape, you'll understand. In the event that they are, I know it's going into a state lottery, and there are several other people that we're vying for the funds. In the event those funds do not come through, is there a way the city can still support that project?
There is a way the city can still support that project, but there had to be a whole lot more skin in the game.
Okay, so if they do not get the funding that they're, or the grant money that they're going after, can the city still make that a viable project?
The city would need to work with the developer.
Work with the
Right.
developer or develop it themselves, I don't know. But, I mean, it's just, okay, it's great, but if it falls apart, then what happens? So,
And that would obviously be you know, a city commission decision moving forward. Yeah.
could some of these funds be used for that?
The American Rescue Plan Act funding can be used for affordable housing,
If
yes.
that project should fall through. Of course, go for every grant dollar you can get.
Yes.
And if that works, maybe another developer would be interested in building some affordable housing.
Yes.
I have a wonderful scheme. You build affordable housing, sell it to them at cost, and then 10 years later you have a balloon note due for half the value of its appreciated value, but it works. But, okay, I was just curious
Thank
about the
you.
Union Street project.
Okay. Anybody else that we haven't heard from?
I just wanted to just follow up again on communications. So our goal is to, try to provide as much information and communications through a variety of platforms, because we realize everyone doesn't utilize the internet, but a lot of people have emails. And one of the things that we are going to be launching in January is a weekly e-news, which is going to, really inform residents of really kind of the the really current information that they need to know, and we're working with all of our departments right now to make that happen. So it will be an opt-in, though. That's the key. People have to sign up. We already have a database of residents, but we're going to do a push and a launch, but we're going to try to encourage as many people to sign up for that. So we hope you spread the word on that when it's ready. Thank you.
So Sue is our communications director, for those of you who came in a little bit late.
And she's new and she's really fixing a lot of things.
Yes, she is. Yes. Yes. Yes, sir.
I don't know if it's too soon, given the, kind of the winding down of the pandemic now, but is there any thought to doing something either just within the town or as part of this project to do, so like if we had to do it all over again and face a pandemic or some other public health crisis as we have been through, where are the key impacts? What things would we do differently? Whether it's, in the water systems, early sensing of viral loads, or, just like you were mentioning, increasing in broadband infrastructure so that more people, not just downtown, which I would be great as well, but I'm just saying for the broader population to improve the coverage, or how we handle medical things with hospitals and funeral homes and all this stuff. I mean, just sort of wondering. I mean, a study that could then say, okay, how would we do this better and be more resilient against these sorts of threats in the future? Would, I think, be useful.
Yeah, I think that's a great point. And I think that we would need to work with Pinellas County Emergency Management to that end. A lot of those items are out of the control of the city of Dunedin. A lot is within our control. So typically when we have a hurricane, we do something called an after action, which we write down everything that happened and everything that we can fix moving forward, and we do fix it moving forward. And I think that there's a lot that we need to address as it pertains to the pandemic. For example, a waterborne issue, or as opposed to an airborne issue, that type of a thing, is really the Florida Department of Health in Pinellas County, and they're the protocols. We followed all of their protocols, and so I'm not aware of any after action, but I'm sure that there is one. We wrote down in the city of Dunedin, all of the protocols that we put in place and memorialized all of them. And that most of those pertain to, our facilities and that type of thing, and keeping people safe. But of course, there was, the state of emergency that was issued on March 13th of 2020. And that actually lasted for almost 2 years. It's the longest ever state of emergency. And during that time frame, we actually had, because we went under hurricane warning a couple times, we had a state of emergency upon a state of emergency. So that's a very good point, and I'll check into it. I'm not aware right now of what's being written down and what protocols are being put in place countywide. We certainly should, for sure.
Suggesting that the city do things that other departments,
right.
It's in their bailiwick, but
right.
It could drive the need, drive the incentive, and perhaps leveraging other counties and jurisdictions to then drive things that would be, in our interest. As well. So.
Right, absolutely. No, very good point. And, when I next meet with all of my colleagues, I'll bring that up and ask that question. It's a really good point. Really good meeting, really good comments. Yeah.
My name is Barbara, and I'm a resident. And I was just curious as to what kind of reporting system the city has for the monies and the categories. Is it to the county or to the federal government? And what sort of time frame is placed on what has to be done by a certain time and what might be planned in the future? For instance, the Coca-Cola property, should that become available and be something wonderful for us, can it be a down the road thing that we say we'll have it an answer or a project to report by a certain time frame? Thank you.
Yeah, good.
Yeah, there are reporting requirements, and they're to the U.S. Treasury. That's who we report to. We report directly to them. The first report is due in April 22 is the first report, and their reports are due every 6 months thereafter. But as far as the timing of what we're really focusing on is, doing the reporting and making sure we're in compliance, but also we have till December of 2024 to obligate the funds. So we either have spent the money by then or we've obligated the funds on a purchase order or a commitment, and then we have till December 31st, 2026 to spend the dollars. So we have, almost 5 years in total, to spend on larger projects, but that's sort of the timing we're looking at. Does that answer your question, or? Yes, it does. Okay.
So, and just as far as where the funding goes and how we assign it, so essentially what we're envisioning is that in February, we're going to present, as I said, these projects to the City Commission. Say, for example, if we were to do a mental health pop-up and fund a mental health pop-up 2 days a week in the library for anybody who wants to come in, they don't have access, then we would need to provide the City Commission with estimates on how much that would cost, the duration, the department that would oversee it, and that would be in that mental health bucket. Then, every bucket would have a certain number of projects that we've already received and programs we've already received the estimate on, and that would be the funding assigned to that moving through it. So again, it's only an estimate, and we would, as we go through the 6 buckets, if you look at our business plan, every goal has a funding source, as I said, and funding assigned to it, but they're not all even, and they change. And so, those particular projects would be in, there's 3.2 million assigned to bucket number 1, there's 7 million assigned to bucket number 2, and that type of a thing. So you'll be able to see that. That will be transparent, and that will be part of our adopted budget. Anybody else? No? Okay, so a couple things. First of all, Phyllis Gorshi is our library director. She's our hostess tonight. I think she went home, but we have cookies, coffee, and all those books at the back and all of those little carousel things. She wants you to take those home. So yes, she's a wonderful hostess, and the pumpkins and the cookies. So anyway, just to reiterate one more time. So second of 3 input sessions. Next one is a week from today. Then we're going to be working all the way through Christmas, and I've already let Les know that we're canceling Christmas, so we're just not having it, and Thanksgiving at this point, and all the way through December and January to put together this program for the City Commission, and we're going to most likely call a special meeting. The City Commission, it's probably going to take them all day, maybe longer, to get through all of this, and I know that they're going to dedicate a great deal of time to the American Rescue Plan Act funding. When we first talked about the American Rescue Plan Act, just the opportunity available to the city of Dunedin to realize some of these programs and projects that we haven't before is right there. It's right in our grasp, and we're really excited about it. So we will be communicating with all of you via your email and let you know those critical dates when the City Commission is going to be reviewing the program. I'm very grateful for all of you being here this evening and for your input. Thank you very much, and have a good evening.